So I'm Joanne Peter. I'm the Director of Innovation at Jhpiego and also a Senior Advisor to the HealthTech Hub Africa, which is implemented by Jhpiego with Vilgrow Africa. So Africa has 24% of the global disease burden. It has 3% of the health workforce, and it has about 1% of the health financing. So those are some very stark numbers, and it is very clear that business as usual in Africa will never work to provide universal health coverage. And so health technologies are really one of the only ways that we will ever be able to deliver healthcare for African citizens. Right now is a particular moment in time where I think that realization is becoming clear. It's an energy, a groundswell of enthusiasm and excitement for health tech in Africa. The Africa HealthTech Summit is about twice as big as it was last year. And so I think there's probably never been a better time for health tech entrepreneurs in Africa who are really trying to solve those challenges with technology. A few things that worry me. The first is that many of these entrepreneurs that are developing amazing solutions, if they really want to move the needle, they need to be delivering those solutions in the public sector in Africa, which means they need to be selling their solutions into government. But at the moment, there is still quite a disconnect between private sector entrepreneurs and public sector governments, with the two struggling to speak to each other, to understand each other, and to work together. So governments don't always know how to procure innovations from the private sector, and private sector innovators don't know how to be procurement ready. And that means that oftentimes these very exciting solutions are not making their way to the people that could benefit the most from them. I'd also say that on the policy and regulatory front, oftentimes the innovation is moving faster than the policy, which means that innovators are working either in a void, in an absence of fit-for-purpose policies, or sometimes they're working with policies that are out of date, or ministries are nervous because things are moving very quickly and they can sometimes have a tendency to over-regulate because they're not confident about the risks that come with the technology. So creating an enabling environment for innovators is something that's challenging. What we hear from the Rwandan ministry, both Ministry of Health and Ministry of ICT, is incredibly encouraging. They have an openness towards private sector innovation that's unusual to see across the continent. They are very supportive of their innovator community. The level of commitment that they show in terms of coming to conferences like this and listening to innovators is very unusual. If you go to the National Health Intelligence Center, you will meet a number of innovators that are working in that space and are actually contributing to the national health system of Rwanda. So it's a very, very positive and inspiring model that they are creating, and hopefully other governments are seeing this and taking note of what it can do for the society. So Jhpiego, along with Vilgrow Africa, is lead implementer of the HealthTech Hub Africa. It's a Pan-African Health Tech Accelerator program. That means it recruits a cohort of health tech entrepreneurs every year and supports them with mentorship and masterclasses and access to investors, ways to strengthen their business, networking opportunities, etc. But it also runs a policy program that supports governments across Africa. So there is a 19-country intergovernmental working group. It's growing every day with new countries that are joining, where members are able to discuss what they are doing to create an enabling policy environment and to learn from each other. And it also has a standards and interoperability lab. So this is a way for startups to bring their solutions to be tested and certified as interoperable, which means that they would be more likely to be able to enter the public health system and be interoperable with the existing health technologies that are in use. We have worked with almost 120 companies since the start of HealthTech Hub Africa in 2022, and they are from across the continent. And we will be recruiting another cohort for 2026, currently in co-design right now with donors and with governments as to what that recruitment should look like. We imagine it will be focused on AI, given that that is the topic of conversation for the continent. Maybe I can just mention that the supporters of HealthTech Hub Africa, Novartis Foundation, Novartis have been amazing supporters, along with the Global Fund, Patrick J. McGovern Foundation, and now recently the Endless Network. And so we're very grateful to the support that they've been providing over the years. I don't know if it's just because I've been listening for it, but this public procurement, it's something that we have been thinking about so much, and I've heard a number of people talking about it in the conference. I think because of the shift in the global funding landscape, with much less foreign aid in the mix these days, there's much more of an awareness that governments now need to start to mobilize domestic financing, and they need to start to procure solutions that in the past were often donated because of a lot of overseas development assistance. And so this topic of public procurement is becoming very pressing because governments are not necessarily that confident to procure health tech solutions. It's very different to procuring hospital beds or vaccines or medications. These are tangible objects, and the procurement process can be more straightforward. But understanding what procurement looks like for a software solution that's subscription-based, that needs service-level agreements, doing that wisely, especially in a very complex ecosystem with a lot of different solutions and without necessarily very clear mechanisms for proving quality and making sure the evidence is there. It's still a new and emerging field. I think this is still challenging for governments, and it's challenging for innovators to know how to access this very important customer of government, which is where most healthcare is still delivered in Africa, and where the biggest potential customer sits is in government, in the public sector. And so that topic is one that to me feels very prominent in this summit. Yeah, so firstly, maybe just to distinguish between generative AI, which is what everybody's talking about now, and some of the AI which has been around for longer, more machine learning approaches. And so I think there's fairly well-established use cases for machine learning approaches. So for example, risk segmentation to try to understand where people may be that are at higher risk, for example, of defaulting on their medication, meaning that you can target your energy towards those higher risk people and in that way use your scarce resources more effectively. So that sort of predictive analytics I think is fairly well established and is very important. Predicting supply chain stockouts, for example. There's a number of examples. Generative AI and use of large language models is what is now really surging to the fore. We are starting to see some emerging evidence. So there have been a study that came out of Penda Health in Kenya, where they showed it was a 16% reduction in diagnostic errors and I believe a 13% reduction in treatment errors for health workers that were supported by a large language model in their consults with patients. There was also some work that was done by the Center for the Fourth Industrial Revolution here in Rwanda, where they were looking at large language models providing answers to community health workers. It was in a very controlled environment, not in a study environment, and they found that the large language models were outperforming clinicians and nurses in their answers to community health workers, meaning that there's a lot of potential to potentially create efficiencies in the system by using large language models to replace for scarce health workforce, to augment what the health workforce is doing and improve quality. But of course it's very new. It's a very unregulated space. We can't move too fast. There are of course lots of questions that emerge about bias in the data sets that are being used, in the recommendations that are provided. There's a lot of uncertainty around when to have a human in the loop to make sure that quality is being assured. So there's a lot of potential, but there is also risk, and so it just needs to move in lockstep, and it means that governments need to be very central to this conversation, because if they don't understand what's happening and feel confident about what is happening, they will overregulate the space. But equally, if they aren't providing the necessary guardrails, we could see harms to patients.